However, if we perform the very same model simulations by decreasing the rate for the constitutive receptor turnover, you can see that the lower the rate gets, the sooner you lose the linear relation. So the constitutive EPO receptor turnover actually acts as a linear signal integrator. So this is what makes the system respond in that way. Now to again validate these findings, we made use of a drug, graphene A. Graphene A inhibits the transport of proteins from the Golgi apparatus to the plasma membrane. And we performed model simulations before going to the lab to actually see which of these different quantities we should measure to get a good output and a good feeling. And it turned out that looking at the amount of EPO in the medium is actually the most robust target for these experiments. So you can see here, this is the normal depletion curve you would get in a undisturbed cell stimulated with EPO. And the lower the rate for the transport of the protein to the plasma membrane gets, the longer the half-life of EPO in the medium will be. So this was our hypothesis, and we then performed the experiment, enriching ligand from the medium and plotting. And here you can see the outcome for the control cells, which are reflected here in this black curve. So again, we have this rapid depletion. And here you can see the results for the graphene A treated cells, so where you don't have transport of receptor to the plasma membrane. And indeed, you can see that here the half-life of E4 in the medium is much longer, consistent with our model predictions. So we concluded that EPO receptor transport is a prerequisite for the system in order to appropriately sample and integrate the ligand. This experiment also shows you the critical role of these large pools of EPO receptor which are present in the cells inside of the endoplasmic reticulum and the Golgi apparatus. So it was always not clear why the cell is producing so much receptor and only like 5% are going to the plasma membrane at a given time. So why does the cell produce so much receptor? Why does it have such a high cost for this? And well, this is the answer. So it just ensures you that there's always enough receptor at the plasma membrane in order to appropriately respond to different heating concentrations. So with this, I would like to conclude our work. So I hope I could show you that the receptor system is characterized by two main features. This is rapid ligand depletion and a fast recovery of receptor at the plasma membrane. And we could show that there is a linear relation between EPO levels and the integral activation of the EPO receptor for a really broad range of ligand concentrations. And this linear relation is realized by the constant receptor transfer to the plasma membrane. And these features altogether actually allow that there's an accurate translation of ligand input into erythrocyte production. Now, thinking a little bit further, EPO receptor signaling is not only playing a role in the hematopoietic system, but very recent studies also showed that you can find the EPO receptor in different cancer cells. And actually there have been different clinical trials where patients were given EPO after chemotherapy, because this is thought not only to improve the quality of life during such a treatment, but actually also to maybe make the treatment more efficient, because the patients are kind of stable enough to receive a chemotherapy, and because if you don't give EPO to the patients and they develop a really severe anemia, often chemotherapy has to be abrogated, because the patients have too low levels of hemoglobin. And but two clinical trials were abandoned in lung cancer and breast cancer patients because there were actually adverse effects of EPO. So it was not only beneficial in helping the hematopoietic system to restore, but actually some patients showed decreased survival rate. And so what we are now doing in the lab is, in the context of lung cancer, is to identify mechanisms of EPO receptor signaling in cancer cells and then compare them to the signaling situation in normal cells. And by identifying design principles, like I could show you here for the hematopoietic system, you can try to figure out if there are differences in design principles, which could also lead to then very targeted treatment, and also to identify maybe markers which would allow you to predict if a patient positively responds to EPO treatment or not. So with this, I would like to thank people who contributed to this work. So once again, of course, the MTZ Foundation and the University of Heidelberg, but also, of course, the people who work on the project. So Ursula Klingmuller for her great support, and Marcel Schilling, Julie Bachmann, Ute Baumann, and also Sandra Manta and Susan Nattermann, who helped me working the experiments, and also in particular Marcel Schilling, who worked with me on setting up the models. And in addition, Andreas Auer and Thomas Maywald and Jens Timmer at the University of Freiburg for tackling all the mathematical problems and for helpful and fruitful discussions on the project. Thanks you.